Okay, it's a couple of minutes after the hour, so I think we'll go ahead and get started. Thank you for joining, everybody. For those of you that don't know me, my name is Susan Ambrosi, and I'm a nurse. I've worked in the home health and hospice field, and I also worked as a surveyor for home health and hospice for many years, and now I'm doing some of these programs for QAPIplus. So thank you for joining us today. We really appreciate it. And this is meant to be an interactive program. So it's really, really helpful if you do have if you're at a computer that has a camera, if you turn your camera on, because then I can see people and feel like I'm actually talking to someone rather than talking to myself. And it's also, we learn from one another just as much as my going through the slides for you. So don't be shy. There's no silly question. There's no wrong answer. This is just all about learning together. So today we're going to talk a little bit about infection control, and we're going to talk about tuberculosis, influenza, some OSHA requirements, and really just some ways in general to protect our patients and ourselves as providers. Some of the things we're going to review are tuberculosis, the signs, the symptoms, the transmission, and how it's treated. We're going to review some general infection control measures to reduce infection transmission. We're going to talk a little bit about influenza and influenza versus the common cold. We're going to go through some strategies to protect caregivers and patients. And lastly, we're going to look at a couple of case studies. So these are just some general statistics on the first couple of slides about TB cases reported by area in the United States. So you can see from the legend there, the very light blue is less than 99 cases, and then the deeper blue, 100 to 299, 300 to 999, and greater than 1,000. So you can see that in California, there's quite a few cases, along with Texas, Florida, and New York. And a lot of the other country is relatively low, but yet TB does still exist out there. This slide takes a look at TB cases by age group. So again, it's across the years. If you look at the most recent data here in 2022, you can see that there are many cases over 65 and some 45 to 64. You can see the numbers there. And then, much less on the younger end, but it really can affect every age group. So what are some of the conditions that increase the risk of TB? HIV, substance use, specialized treatments such as for rheumatoid arthritis or Crohn's disease, organ transplants, if you have severe kidney disease, head and neck cancer, diabetes, medical treatments such as receiving corticosteroids, low body weight can put you at increased risk, and babies and young children are also at increased risk. Some of the places with increased risk: if you are born in or frequently travel to countries where TB is common, such as Asia, Africa, and Latin America. If you live in large group crowded settings, such as homeless shelters, prisons, jails, they can also have an increased risk just because you're with a larger population. And if you work in places that TB could spread quickly, such as hospitals, shelters, again, prisons, and nursing homes. So anywhere where you have a large group of people together, just as other illnesses can spread, such as COVID, the flu, etc., TB also can spread more rapidly. So the exposure to TB is spread through the air from one person to another. The TB germs, they're put into the air when someone talks, coughs, speaks, or sings. And these germs can stay in the air for several hours, depending on the environment. So the germs are more likely to spread in an indoor space versus an outdoor space, or where there's poor air circulation. And people who breathe in the air can become infected with TB, but not everyone that becomes infected with the TB virus will become sick from it. And we're going to talk about that a little bit more. So inactive TB, that's when you have a small amount of the TB germ that you've been exposed to that's alive, but it's inactive. So you don't have any symptoms of TB, you don't feel sick. With the inactive TB, you cannot spread the germs to others. You'll usually have a positive TB blood test or a skin test that indicates you've been exposed to the infection, but you'll have a normal chest x-ray and your sputum will not show any TB also. So you can have treatment for inactive TB to prevent becoming active TB. So in active TB, that's when you have a large amount of the active TB germs in your body. So with this one, you are going to feel sick, you are going to have symptoms, you are more likely to spread the TB germs to others. You'll usually have a positive TB blood test or a TB skin test indicating that you have the infection. You may have an abnormal chest x-ray that shows the TB, or a positive sputum smear or culture, and you need the treatment. So some of the signs and symptoms of active TB that you might have for screening is a cough that lasts 3 weeks or longer, chest pain, coughing up blood or sputum, that's a big one that they'll look at TB, weakness or fatigue, weight loss, loss of appetite, having chills, fever, and night sweats. Night sweats is another big one that patients will also complain of. You can have any of those symptoms and your physician may be thinking you've been exposed to TB. So these are some of the treatments that are given for TB. A lot of these have been around for a long time and, are very effective, but people really have to be followed up and be sure that they take the medication, that they take it for as long as prescribed, so that it can clear the TB and not cause a major outbreak. Any questions about TB before we go on to talking about influenza? Have you come across anybody with TB in the home since you've been providing care in home health? Okay. I used to work at TB clinic. One of my first jobs was at a county health department, and we had TB clinic every month. And when I think back on the small little room with poor ventilation that we saw those TB patients in, it's amazing I never converted to a positive TB skin test, but I never did. So we're going to talk a little bit about influenza or the flu. I've already had my flu vaccine for this year, and hopefully many of you have as well. Or if you haven't, that you will consider getting the flu vaccine. So the flu is a contagious respiratory illness caused by the influenza virus that infects the nose, throat, and sometimes the lungs. It can be very mild or it can cause severe illness, and every year there are deaths related to the flu. And the best way to prevent getting the flu is to get a flu vaccine every year, because the flu mutates and it's a different strand of the virus every year. The vaccine is reformulated, so it's really important to get the vaccine every year. So some of the symptoms of flu are fever or feeling feverish or having chills, a cough, a sore throat, a runny or stuffy nose, muscle or body aches, headaches, feeling extremely tired. And some people may have vomiting and diarrhea, though this is more common in children than adults. It's not usually vomiting and diarrhea associated with the flu. So there are 4 types of influenza viruses: A, B, C, and D. A and B viruses are the ones that cause seasonal epidemics of disease in people, known as the flu season, almost every winter. And we're going to be just getting into the flu season, right? Influenza A viruses are the only influenza virus known to cause flu pandemics, such as a global pandemic. The influenza C virus infections cause mild illness and are not thought to cause human epidemics. And influenza D primarily affect cattle with spillover to other animals, but have not been known to infect people to cause illness. So if you hear people talking about A, B, C, or D, now you know what those definitions are. So in terms of flu prevention, the CDC recommends a yearly flu vaccine as the first and most important step in protecting against the flu virus. And I know there's still a lot of people that are hesitant to get the flu vaccine. There's a lot of myths out there that they think the flu vaccine causes the flu, but it's really the primary step that you can take to help protect yourself and others. The flu vaccines help to reduce the illness and prevent hospitalizations and deaths. So if you do get the flu, it'll be a much milder case and prevent hospitalization and death. All flu vaccines are designed to protect against the flu viruses that the research indicates will be the most common. So that's, like I mentioned, that every year the flu vaccine is reformulated so that it can address the flu that they expect to be a problem this year. So it's recommended that everyone 6 months and older should get an annual flu vaccine, ideally by the end of October, but it's certainly helpful if you get it now. But ideally, they look for people to get it by the end of October. Vaccination of people at higher risk of developing serious flu complications is really important because that will decrease their risk of having a severe flu illness, being hospitalized, or even death, because there are elderly people that get the flu every season and they don't survive it. Some of the people at higher risk of serious flu complications include young children, women that are pregnant, people with certain health conditions like asthma, diabetes, heart and lung disease, and people that are older, 65 years and older. Vaccination is very important for healthcare workers and other people who live with or care for people at high risk so that you don't spread the flu to them. That's why you'll see many healthcare institutions will require staff to get the flu vaccine. There are many health systems, I think Kaiser is one of them, that requires their employees to get the flu vaccine. If they can't get it for some reason, or if it's contraindication, then they have policies. They have to wear a mask during the flu season. You know, they have to take special precautions, but ideally they're encouraging everyone to get it, not only to protect themselves, to protect others around them and the patients that they care for. And young children, younger than 6 months, are at higher risk of the flu also being very, very serious. And this is where you will see infants hospitalized and having more serious repercussions as part of the flu. So, flu prevention, well, what's the number one thing that we just talked about? Getting that vaccine, right? So taking everyday preventive actions is recommended to reduce the spread of the flu. So avoid close contact with people who are sick. If you are sick, limit contact with others as much as possible. Just kind of common sense things, right? You don't want to be around someone who's sick. They don't want to be around you if you're sick. Cover your cough and sneeze. It absolutely drives me crazy. I was at the gym this morning and somebody on the next treadmill was hacking away a little bit, and I left that treadmill and moved on to something else because I don't want to be around that, you know? I mean, it just amazes me that people don't sometimes cover their cough into their arm, to protect others. Um, Washing your hands is another thing that is a big protection, right? We're going to talk a little bit more about hand hygiene a little bit later on in the slides. Avoid touching your eyes, nose, and mouth because germs really spread this way. So I know myself and the next one has to tie with it too, cleaning and disinfecting surfaces. And for the flu, the CDC recommends that people stay home at least 24 hours after their fever is gone, except to get medical care or other necessities. So let me tell you that I personally traveled because I was in New York, even during COVID. I have a son and his family that live in California, and plus I worked and did surveys. So I traveled during the entire pandemic on flights, many, many flights. I wiped down the surfaces every time I got onto a plane. I use the hand sanitizer after I check my luggage. I constantly use the hand sanitizer. I was very, very careful never to touch my eyes, nose, or mouth. And knock, knock, knock. I never got COVID. Yeah, I should knock on the wood here. Hear that? So, I mean, maybe it's a coincidence, and I also get the flu vaccine, so I don't get the flu either. And again, I travel a lot. And during the pandemic, I used to come home and people would be like, "Oh, I don't want to see you for at least, 5 days in case you come down with something," but knock, 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 I didn't. So I do think getting the vaccine and taking those precautions, it does help. So you're going to hear me say this a million times, right? Please get your flu vaccine. And I'm sure your place of employment is encouraging this as well. And they're probably tracking statistics as to what percentage of their employees get the flu vaccine because it can help you from getting really sick with the flu. It can reduce the severity of the illness. It can reduce your risk of hospitalization. And it's super important for people with chronic conditions, cardiac, respiratory, diabetes, obesity, etc. And it'll help protect pregnant women and the baby for the first few months of life. And it can be life-saving for children, and it can protect yourself and others around you. So it is advisable. And I know it's a scary thing sometimes to some people. My daughter is actually expecting right now, and her obstetrician said, they recommend certain vaccines at what week in pregnancy you should get those, and she is doing that. And the next visit, the nurse comes into the office and says to her, "Wow, you're really brave that you're going to get such and such a vaccine." And my daughter said, "Mom, I thought that was so unprofessional of the nurse to say that because the doctor already talked to me about this." So again, there's many different thoughts, opinions, myths, etc., around these vaccines, and it is an individual decision, and I know that. But it can be very, very, very important. So some of the complications of the flu are pneumonia, sinus and ear infections, myocarditis or an inflammation of the heart, encephalitis, inflammation of the brain, different problems with muscle tissues. You can have multi-organ failure. You can get an infection of your respiratory tract, which can go to your full body, which could lead to sepsis. Flu can also make chronic medical problems worse. For example, people with asthma may get asthma attacks worsening with the flu. People with chronic heart disease may have a worsening condition if they have the flu. So this is just a slide that shows some of the difference of, is it a cold or is it the flu? So the cold has a very gradual onset, right? You sort of feel like something's coming on, little stuffy nose, little tickle in your throat. But the flu a lot of times will come on very abruptly, like you just feel like a truck hit you. A fever with a cold is rare, but you usually have a fever with the flu. Aches and pains, not that common with a cold, but very usual for the flu. Chills, again, not that common with the cold, but fairly common with the flu. Fatigue and weakness is, again, more pronounced with the flu than a cold. Sneezing is common with a cold, not as common with the flu. Chest discomfort, you might have mild to moderate with the cold, but you might have a lot of that with the flu. Stuffy nose is common with the cold and the sore throat, but may not be as prominent with the flu. And then the headache is rare to have a headache with just a cold, but very common to have headaches with the flu. So those are just some of the differences that you can distinguish between, is it the cold that I have going on, or is it the flu? Some more statistics on, oops, wait a minute. Trying to move over my pictures here. Of the flu. So this is the most recent that the CDC had on since October 1st of 23. This is what they estimate there have been 34 to 75 million flu-like illnesses, 15 to 33 million flu medical visits, 380,000 to 900,000 flu hospitalizations, and 17 to 100,000 flu deaths. So it's pretty substantial, right? And one of the reasons you have such big ranges is because it's not always reported. So it's difficult data to track, and they do the best they can with the data that comes in. So that's right from the CDC. Okay, so now we're going to move on and talk just a little bit on some infection control, some hand hygiene, a little bit on sharps, and talk a little bit about your agency's use of personal protective equipment. So here's a polling question. You can answer in the chat box, or you can open up your mic and answer. Are you aware of your agency's exposure control plan? Who knows if their agency has an exposure control plan? Anybody? An exposure control plan may cover things such as, what do I do if I have a sharp injury? What type of personal protective equipment do I wear? What do I need to report into the office? That would all be part of an exposure control plan. Anybody out there have seen it, have education on it, or aware of your agency's exposure control plan? Okay, so if no one's typing in the chat box, nobody's answering, so I would suggest that you go back to your leadership and you ask to see your exposure control plan, because I'm sure they have one. Okay, so somebody put a note here. We call it infection control plan, but you had an in-service on that. Okay, good. Michelle, thank you. All right, so shorter hospital stays and technology improvement has really led to more procedures in the home and more use of sharps. So the WHO estimates that 1 in 10 healthcare workers worldwide sustain a sharp injury each year. And as a result, they're exposed to bloodborne. They can be exposed to bloodborne pathogens such as hepatitis B, hepatitis C, HIV, etc. So you really need to be thinking about your use of sharps, how do you dispose of sharps? So why proper sharps disposal? Because used needles and other sharps are dangerous. They're dangerous to people, they're dangerous to pets if they're not disposed of properly. They can cause infections such as hepatitis B, hepatitis C, and HIV, like I just mentioned. Safe sharps disposal is important whether you're at home, at work, at school, traveling, or in hotels, parks, restaurants. I'm sure you've seen in the airport restrooms, sharps containers, because nobody wants anyone throwing a sharp into the general trash that somebody else could get poked with. So never place a loose needle and other sharps that should go into a sharps disposal container in the household or public trash or recycling bins, and never flush them down the toilet, because this really could cause harm to someone, right? The trash people, the sewage workers, the janitors, the housekeepers, household members, and children. If you don't dispose of sharps properly, it can cause injury to someone else. Even pet owners need to be aware of the needles they use to give medicines and follow the same sharps disposals. One of the things that OSHA requires is that employers consider safer medical devices whenever possible. The market is always having new needleless built-in protection for sharp devices for people to use so that, no one's recapping and it's just less chance of injury. So employers should be asking their patient care workers who are exposed to sharp for their input in identifying and evaluating and selecting effective work practice and engineering controls, including safer medical devices. And the employer must document consideration and implementation of these devices, and that they solicited worker input in the exposure control plan. So this is right out of OSHA, that the home health agencies and any healthcare agency should be looking at safer medical devices that are safer to use in terms of sharps, getting their employees' input, and documenting that as part of their exposure control plan. What do you do if you are accidentally stuck by another person's used needle? Is to wash the exposed area right away with water and soap, or use a skin disinfectant such as rubbing alcohol or hand sanitizer, or both. And seek immediate medical attention by calling your physician or local hospital. And what else? What else isn't on this slide that you need to do? What else do you need to do if this happens on your work time? Do you think you might need to report this to leadership?
Definitely have to
Immediately?
report it.
Exactly. So let your supervisor know, and I'm sure as part of either their infection control plan or their exposure control plan, they have a process that they're going to go through. So they need to know so they can go through that process. Has anybody had this happen to them or someone you know that you work with?
No.
No, I haven't either. Thank goodness. But, I know that people I've worked with have had this happen, and, there's a very strict process that they need to go through. So, which could involve testing the patient in some way, shape, or form, if that's part of your policy and if the patient allows it. So you do need to report it to leadership so that you can follow your agency protocol for a sharp incident, and collect data on sharp incidents too, so that you can learn from someone's not necessarily a mistake, but incident, so that it hopefully doesn't happen to somebody else. So one of the things that needs to be done in this area is education and training. So healthcare workers should receive thorough training in sharp safety protocols, the proper handling and disposal, and the use of safety devices. And you also need to educate your patients and their caregivers about the safe disposal of home-generated sharps, such as those for self-injections or blood glucose monitoring, and provide information on community disposal options, such as drop-off locations or mail-back programs. So this is different in every town, every city, every state, but you can usually find that by Googling, your community, your zip code. What are the community disposal options? Are there any drop-off locations? What is the protocol? And how can things be disposed of correctly? We're just going to touch on PPE briefly because this really is dependent on your agency's policies and procedures, what personal protective equipment you use, and it also really depends on what is the procedure you're doing. How risky is the procedure, whether you need gloves, gowns, surgical mask or N95s, any eye protection such as goggles, face shields. So you really need to look at your agency policy and procedure for what procedures require what equipment. And you should be looking at the risk of the task. For example, if it's a risk of splashing blood or body fluids, then you're going to want to wear the whole 9 yards, right? The goggles, the gown, everything. If there's really no risk in what you're doing, you may only need gloves. So it would be good to hear from you. How do you decide what personal protection equipment that you're going to use? And what does your agency say about that? And again, there's no right or wrong answer. I just want to stimulate some conversation. Who has an example of a procedure you've done recently and what PPE you used and why? Anybody?
No.
No. Okay. So it's really evaluating like a simple, dry sterile dressing to a superficial wound that doesn't have much drainage versus a very deep wound with a wound vac with a lot of drainage. There's a difference there, right? So you might want to use different equipment for one versus the other. Right? If you're doing some type of an irrigation of a wound, again, that's different than, something that's not much more than a Band-Aid. If you're doing any type of suctioning of a trach or that type of a procedure, again, you can look in nursing care plan books at the procedure, what's recommended. You can look at your agency policies and procedures. So let's see. Michelle says, learn in IDT meetings of any issues for full PPE at visits. As a dietitian, I don't usually need to have much contact. I always wear a mask by personal choice. I also call before my visit and ask if any illness is in the home. Okay, so that's a good preventative action is to call ahead and see if there's any illness. Did you start doing that, Michelle, during COVID? Because that's what a lot of people were doing then, and you've just continued that? Somebody's also in my sniff jobs, we have signs posted on the door which direct what PPE is required. Okay, that's good. And you said, yes, Michelle, you started that during COVID. Phone ahead to see if they have any, anybody that's ill in the home. That's a good idea. Yes, MRSA has its own special equipment. And sometimes you even bring in disposable equipment that you're going to, like a disposable blood pressure cuff and a disposable stethoscope that you're not going to use after. So you're not going from one patient to another, right? Any other comments or questions on PPE before we talk about hand hygiene?
All I do with the patients is I always ask ahead. If anybody's sick, please let me know before I show up.
Okay, that's a good idea. And what happens if they say yes?
Um, actually, from the other place I worked, they gave me some gowns and I keep them in my trunk of my car. And I
Okay,
bought masks. So I have my emergency supplies so when I'm prepared.
okay. Have any comments on personal protective? I think what someone meant to say is it says we should have gone for bed bath, but maybe we should have gowns for bed bath, they might mean. And you see a large variation as I surveyed around the country, in what personal protective equipment that home health aides would use to give a bed bath. I mean, you see everything from just gloves to gloves and a gown, to nothing, just using hand sanitizer. And a lot of times it does depend on what is your agency policy and what's happening with the patient as well. I mean, most aides, I think, do like to put a gown on because they're putting somebody into a shower, into a bath, and it keeps them dry and safe and things like that. But you don't always see that. So it is surprising. And there's really no set standard other than to look at what the agency's policy and procedure is and how do they develop that policy and procedure and what literature did they use to develop their policies and procedure? Does it make sense? But there's not necessarily a right or wrong. It just comes down to, what is the policy and procedure and how did they develop those with what resources? So there you do see a lot of variation from agency to agency. Okay, we're going to talk a little bit about hand hygiene now. So hand hygiene is a general term that applies to either hand washing with your soap and water or hand sanitizing, using a hand sanitizer. So for hand hygiene, immediately before touching these are time points in which you should think about doing some type of hand hygiene. Immediately before touching a patient, before performing any type of a task, before moving from working on a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, after contact with body, blood fluids, or contaminated surfaces, and immediately after glove removal. So those are the time points you should be thinking about doing hand hygiene. I'm getting a little hoarse because I'm doing so much talking. So hand sanitizer. When decontaminating your hands, you use an alcohol-based hand rub, at least 70% alcohol. Apply the product to one palm of your hand and rub your hands together all over, front, back, in between your fingers. And the important thing is to rub in until dry, which is what the manufacturer guidelines are generally on the product. So I used to see people, put their hand sanitizer on and it would still be completely soaked. Then they're trying to put gloves on top of that, or they'd rub their hands or they'd put the hand sanitizer on and then they're shaking their hands all over the place. No, that's not a good practice either. The best thing is to put that little dime size or bit of product, rub it in all over your hands, in between your fingers the best you can, and just keep rubbing until it's dry, and then you're done. For hand washing with soap and water at the sink, scrub your hands for at least 15 seconds, again covering all the surfaces of the hands and the fingers, both sides, in between your fingers, etc. Rinse your hands with water, Dry thoroughly with a paper towel and be sure to use the towel to turn off the faucet. So I've probably talked about this before because we've talked about hand hygiene in some other programs that I've done, but it's an area that sometimes when you have somebody with you, either your supervisor or a surveyor, people can get caught up in this because they think they have to do both. You don't have to use hand sanitizer and wash your hands with soap and water, one or the other. There's certain times that you can't use hand sanitizer. If they have C. difficile, for example, you have to use soap and water. So outside of that, it's very convenient. Most people have hand sanitizer with them and it's easy to use. You don't have to disturb things in the patient's home, etc. The other common error I used to see is people using the bar soap in the patient's bathroom. And that's a no-no too. You want to, and then we would go right back to your policy and say, what is the agency telling you should use? Who provides the soap? Where do you get the soap from? How do you know what the soap is? Because using someone else's bar soap that they've used, really not a good idea. Fingernails. That's another one that can be a hot spot with people because some people like their nails, but the CDC recommends that you have natural nails, no artificial nails, and that they be kept to 1/4 of an inch in length. So pretty short. And that's another area. So remember I was talking about all those plane rides that I took during the pandemic and I still take all the time. Keep your nails short because long nails harbor organisms. I know the artificial nails can be nice, and maybe I'll do that on a special occasion, like my daughter's wedding or something. But as a rule, I don't. And the agency should have a policy that addresses nails. So, what is your policy? Are you watching your staff in terms of what your policy is? So I may not be popular after this discussion on nails because I know people like their nails, but think about it. Okay, so the last thing we're going to do is we're just going to talk a little bit about 2 case studies here. So the first one is a home health agency serving immunocompromised patients experiences a flu outbreak among staff and patients during the flu season, leading to increased hospitalization rates among high-risk patients. So what are some of the things you should think about with that scenario in terms of what can be done? You have immunocompromised patients, there's a flu outbreak with the staff and patients, and increased hospitalization rates. Okay. Here are some of the things. Is a vaccine campaign. Educate all your staff to encourage the vaccine and also encourage your patients and families. How many of you are collecting the data from patients and families as to whether they've had the flu vaccine? And I know as part of QAPIplus, because it pops up when I get on their application, you can log in and say whether you've had the vaccine. So that way your agency can collect data to see what percentage of your staff have had the vaccine. But some agencies also collect this data on patients and families. So are you guys looking at that at all? Okay, another thing that you can do if you get into that case scenario where there's an increased rate of the flu is self-screening of all staff and routine patient screening for symptoms. So one of the gals here, Maggie, I think it was, just talked a little bit about calling the patients before the visit. But you do remember during COVID, we had staff self-screening themselves in the morning. Do they have a fever? Do they have any signs and symptoms of COVID? Where you can, some agencies do that routinely during flu season as well, because you don't really want people coming to work if they have signs and symptoms of the flu, right? And the last thing is the strict hygiene and use of personal protective equipment with those patients that are immunocompromised. Okay, case study number 2. A home health agency identified several patients with MRSA. Concerns were raised about the spread of MRSA among other patients, particularly those with compromised immune systems. So you have a patient with MRSA, you have other patients compromised. What things should you be considering in this situation? Anybody help me out? Anybody have any thoughts? There's no right or wrong answer. We're just generating ideas for how could you handle this situation? Have you, any of you had a patient with MRSA that you've cared for in the community before? And what were the precautions that were taken? Okay, we got one person that might have written something. Hand washing, contact isolation, PPE. Great. Yes, those are all things that you should consider. Yes, thank you, Michelle. Michelle, I think it was actually you that typed in before. Thank you. Okay, so these are some of the things. Staff education on your policies and procedures related to MRSA. Many times organizations do have policies specific to MRSA since that can spread so easily. Use of disposable equipment and also limiting what you bring into the home, period. Do not bring anything more than you need for that particular visit. And a lot of times agencies will have disposable equipment that they're only going to use for that patient, or at least equipment assigned just to that patient that has some sort of a terminal disinfectant process after they're done with it. Any isolation protocols, any use of PPE, and also educating the patient and the family on MRSA, how it's spread, what they can do to minimize. So, you might have to read up on this one and kind of refresh your memory. That's what I would have to do when I would be in home care and come across something that you don't see every single day, but you want to make sure you're handling appropriate if that happens, right? Okay, so in summary, infection control practices like the ones we've discussed today are very important to keep ourselves, our patients, and their caregivers safe, right? They're really counting on us as healthcare providers to keep them safe, to use the PPE, to do the hand hygiene, to follow the agency's infection control protocols, to get the vaccine if we're able to. Um, our patients and our families are counting on us for that. And you always need to remember that everything always stems back to your agency policies and procedures regarding infection control practices, what's expected, and reporting of incidents. So I know with your QAPIplus that you all have, that platform, you right on the QAPIplus, you probably can see the infection control plan and review it. Also, as part of QAPIplus, you can report the incidents. So if you had a splash in your eye, or if you had a needle stick, or whatever the incident may be, you can report that within QAPIplus, which allows your agency to run reports, and that allows them to track and trend data to make changes in policies, make changes in protocols, do staff education, so that we're always improving. And lastly, there's some resources here that you can review on your own time. There's a good one on TB. There's another OSHA page, and there's also a CDC reference in regards to influenza. And finally, I know you're a very quiet group, but are there any questions? Comments? Questions? Let me open up the chat to see.
I have a comment.
Okay?
Regarding the hand washing
Yes.
tab that you were talking about.
Mhm.
Now I know you mentioned like using a paper towel to turn the faucet off.
Right.
But would it also be good for like if say the door is closed for whatever reason that they would need to use a paper towel to open the door as well?
Yeah, that would be good. I mean,
That was the
I'm
only
sure
thing
a
that I
lot of
seen
us
that
do
wasn't
that now.
obvious.
I'm sure a lot of us do that now since COVID. I mean, almost every single public restroom that I go in now, whether it's here at the landings where I live at one of the clubhouses or a restaurant downtown Savannah, there's always a garbage can near the bathroom door, right? Because people are using the paper towel to open the door. Because those doors are always closed. In somebody's house, it may not be closed, but in a restaurant, you know, you have to get out of
Yeah.
that bathroom, right? Have you noticed that since the pandemic?
I've noticed that, but I still see people that do not do that.
Yes,
So
yes, yes.
yeah,
I
so
mean, for a while there, I'd be opening the door with a paper towel, and then I'd kind of hold the door open with my body, and I would throw the paper towel if I could make the basket into the garbage can, if it wasn't near the door. And probably people were doing that. So
yeah,
just about every bathroom now
now
has a
has a
garbage can near the door.
right.
Right, right, right. So those are, I mean, I did a lot of those practices before anyway, because you don't know if the person in front of you did wash their hands, right? After they leave the bathroom, so. Any other comments? Well, I want to thank you all for joining us today. I believe the next, program is going to be on emergency management. And it's going to be on Thursday, December 5th at the same time. So emergency management, Thursday, December 5th. And I'm sure you'll be getting an email for that. Somebody, Michelle, put the comment, I like the public doors that have device where you can use your foot to open. Yes, and if they have a foot to open the garbage can too, if it's a closed garbage can, that's really appreciated. Even, I just saw that in the newly renovated Newark Airport. They have garbage cans, big garbage cans now, and recyclable, all of them. And you can use your foot to open those, which is great. So helpful. Any other questions or comments? So mark your calendar for Thursday, December 5th, if you're interested in emergency management. I want to thank everyone for joining us today. We really appreciate you. We appreciate your loyalty to QAPIplus, and I'll be seeing you in December. I can't believe it'll be December already.
Thank you, Susan.
Thank you, Jonathan.
So much. Bye-bye.
Bye, everybody.
Bye.